Turn now to the coronavirus outbreak. The latest on that, a new case confirmed right here in the U.S. One of the Americans evacuated from Wuhan coming down with the virus in San Diego. This as the number of cases worldwide now tops 42,000 and the number of deaths is over 1,000. Maggie Rulli joins us from Yokohama, Japan, where that quarantined cruise ship is still docked this morning. Good morning to you, Maggie.
Cecilia, good morning. The U.S. Embassy has promised to do everything they can for all the Americans on board that ship. And now we also know that a specialist from the CDC is here on the ground in Japan to help. This morning, San Diego is now the site of the 13th confirmed case of the novel coronavirus in the U.S. after an adult has tested positive while undergoing further testing at the federal quarantine at MCAS Myanmar. This as tension rises in Japan. At least 135 confirmed cases of the virus on that quarantine cruise ship.
Guests inside cabins without windows and fresh air must start to spend more time outside.
The ship's captain announcing more outside time for guests without windows, attempting to keep passengers healthy and active. Passengers say the crew is taking extra precautions.
Just as of yesterday, they brought us new masks. These are a little bit more thicker, a little bit more sturdy, intense, whatever. And they want us to now wear these when we open the door to get our food, anytime we open the door to get anything.
Princess Cruises is now taking steps to protect future trips in a statement saying any individual who has traveled from or through mainland China, Macau, or Hong Kong within 14 days of the start of this cruise will not be permitted to board the ship. The virus has now sickened more than 40,000 people, the death toll rising to more than 1,000, with about 3,000 additional cases in the last 24 hours. Hong Kong evacuating 100 people from an apartment complex after two people who were separated by 10 floors both tested positive for the virus. Authorities suspect a bathroom renovation caused air to escape through a pipe. Meanwhile, chilling images coming out of Chinese social media. Teams of people in hazmat suits seen dragging a panicked family from their apartment after they reportedly refused to self-quarantine. And this self-described citizen journalist defying the Chinese government to report on the shortages of masks and protective clothing now hasn't been seen or heard from in days. The 34-year-old man had already expressed anxiety over both the virus and the government's ability to silence dissent. This as Chinese President Xi Jinping made a rare appearance in a surgical mask, touring public locations and a city hospital in Beijing Monday afternoon, according to state media. But as the virus spreads beyond China, the search is now on for a so-called super spreader, a businessman from England who traveled to Singapore and then France, the UK, and his local pub. He's believed to have passed the virus to at least 7 different people, now linked to cases in 3 countries. On average, medical experts think that someone with this new coronavirus typically gives it to about 2 to 3 people, but a super spreader can give it to 3 times that amount. And guys, that is why medical experts are so concerned about them. They have a massive impact on this outbreak. Guys.
Okay, Maggie, thanks. We've got one of those medical experts right here. So let's bring in Dr. Jennifer Ashton. You just heard Maggie mention this in her report, that there are these new reports out there suggesting the virus might be spreading through buildings, even through pipes. And this seems to be raising new concerns about how this spreads.
Cecilia, if that were true, of course, it would be concerning. The key thing right now is that as much as everyone wants to get out there with facts, we don't know. And we're not comfortable in our society, just like we're not comfortable in medicine and science saying we don't know. But that's the honest answer right now. So rather than spread fear with, theories or things that we can't confirm, right now we have to say, okay, true, and maybe related, maybe unrelated.
Well, quarantining has been a big part of all of this, but what are the potential risks and the potential benefits?
Well, Michael, when we see governments take preemptive steps like quarantine, isolation, travel restrictions, we have to be clear that is to safeguard public health, and it can be incredibly important. It's one of the key steps in managing an outbreak that they go identify, isolate, then diagnose and treat. And while absolutely it's not pleasant and the downsides would be stress and an upset, and in the case of one of those ships, the crew being very closely confined, different than the passengers, there are some risks there that we need to evaluate, but on whole, their benefits outweigh those risks.
And Jen, President Trump had a lot of people scratching their heads when he said that warm weather will kill this kind of virus.
We don't know. I mean, MERS spread in the Arabian Peninsula at 110 degrees, so we just don't know know yet with this novel virus. Again, we have to be able to say what we know and what we don't know. There's no evidence of that yet.
And so much we do not know. Jen Ashton,
exactly.
thanks very much. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.